So the next step. So, moderate activity. And this is just super linear stuff. Just like this. Just really light. And she's only doing linear stuff right there. Just straight stuff. No rotation. The reason we don't want to introduce rotation right now is because we're not sure that they're going to get symptoms. So this is day 3, and then you wait, and you see, are we ready to go next day? So next day, so now we can go a little harder. Non-contact, intense exercise, kicking sequences, Poomsae you can start letting them do the turning kicks in the patterns, the jump kicks, etc. And for this one, she's doing more rotation at this stage. So she's doing like back kicks and motion, that sort of thing. And then strength and conditioning, you can do a fair amount of it where the head isn't getting all turned all over the place. So strength and conditioning choices. You could do burpees if you wanted. What else would you do in a strength and conditioning class?
Push-ups.
Push-ups you could do, yeah. Those are good. At this stage, not the beginning. That's a bit, there's some crazy stuff like judo roll stuff. Don't do that yet. That's going to be coming late. Okay. And then, before step 5, we recommend that we get a clearance. So, sometimes you go to a medi, a walk-in, and they don't even know if Taekwondo is what it is. They're like, is that a dance? I don't know. They sign a thing, right? You don't want that. You want to see somebody that knows what's going on, preferably a sport doc or a team doc or somebody that's your family doc that knows you. And then, full contact practice. So this is obviously this is before competition. So this is the last phase. And cautiously playing with each other without, full contact. So there's a chance that they might have contact, but you're kind of just cautiously doing it. So when the person's coming back from concussion and they are sparring, you got to pick their partner smartly, because they also have to have good control as you're reintroducing the person to contact. And then the final stage is competition. And you can simulate that if you need to, but that's the final stage. So that's all great, and that's fantastic. If it goes well, every step is 24 hours, and then hopefully, for most people, it's all good. A week later, they're back to normal. I wanted to talk to everyone about something that is missed, and that's persistent post-concussion symptoms. So there's this stat that's been quoted, and this is from pediatric hospitals and from concussion research and clinical emergency room visits. 1 to 15% of pediatric patients with sport-related concussion will have persistent symptoms for over a month, and they don't recover. That's 1 in 10, maybe 2 in 10. That's kind of scary, and we're missing it. And these kids, they just don't seem to get back to normal. So if you have a person that, say they're acrobatic, freestyle Poomsae, they come back from their concussion, and they kind of come slowly back, but they're just not landing their stuff, or they're a little hesitant after concussion, or you're like, what? They used to be able to do that before. What's going on here? It may be unresolved, what we call vestibular ocular, which is a big word. Vestibular ocular reflexes have not reset, and it can be part of this phenomenon. I had a a story of a lawyer who was on a snowboard, took her helmet off, he got creamed at the bottom of the hill, and it took her 11 months to come back. And what the problem was, is she was trying to track and read all these documents, because they do a lot of reading, and she was getting a tracking error. So she couldn't, it was like she was getting a as she was reading, and it took a while for her to get referred to us. And then when we saw her and did the exam, we're like, your vestibular ocular reflex is not fixed. And then it took us months to figure that out. So for some of your athletes, if they're not returning well after concussion, this may be the problem. It's 1 in 10. 1 in 10 concussions in kids. So I bet you, we always joke around in medicine that this disease has seen you, you just haven't seen it. You probably have seen this and wondered what the heck is going on. So that's my presentation, and I'm up for questions.
Dr. DeFeritas, that situation, if not diagnosed properly, it can last a lot longer.
It can last
You can
years.
actually have brain injury for quite some time. Some people for the rest of their life, obviously, with severe cases.
Yeah.
Would you say this is a typically missed thing?
It's very
people?
missed.
You know 1.5 of pediatric, but could it
Yeah.
be a lot higher because of what you don't know?
Yeah, I was really lucky to be able to present a more clinical story on this at the World Taekwondo Medical Convention a couple years ago, because it is so badly missed,
Yeah.
and for doctors who don't study concussion may not be aware of it.
Thank you.
Actually,
Dr. DeFeritas?
Yeah.
Can you elaborate maybe on any future rule changes that you might foresee coming because of the concussion protocols and dangers?
Well, for I mean, I'm doing some work with the Association of Ringside Physicians, and you know, that's up for pro athletes. Our concussion rules right now, they have this blanket, you know, boom, it's 60 days or 30 days after a documented concussion in a sanctioned World Taekwondo event for sparring. It's kind of a blanket rule. It's good in a way because it gives you a net. But honestly, concussion could be going on for 30 days, or it could be shorter than 30 days. So to me, we shouldn't just have a blanket rule 30 days. We should say they should have testing, they should have neuropsych testing, and once they're cleared for that, then they can go back, regardless of time. Yeah.
What happens after a second concussion? They get concussion after they come back, or how they get another one?
Yeah, that's a great question. So, it depends on if they get a second concussion where they're still in a concussion phase. That's much worse than I had one 2 years ago, and I'm recovered completely, and I have another one. So there's not a lot of research support saying that's the same thing. So say you have one concussion, 30 days later you have another one, that's bad. If you have one concussion here, one concussion here, it's usually no consequence. It just depends on what kind of, where you were at with the first one. So we don't have a number, like we don't say, great, you're out. We don't do that. We do a full assessment trying to figure out where they're at.
So the old, right there, the old adage used to be 30 days after the first one before returning. And then it used to be a year after, or a year after the second one, and then third one was no more competition.
Yeah,
It used to be the old adage.
that's kind of an arbitrary safety. I mean, that protects you legally, as a sport really well, but it, you know, it's probably not the best medical way to go. Yes?
What would be a considerable length of time that you're unconscious where it would be considered real serious? Like I've seen people knocked out for like 15 minutes.
Yeah, so what we do when they're unconscious, like you saw me run in there at the beginning. So if it's a few minutes and they're recovering and they're getting better, that's great. But once they're